Hello, MA101 students. As you know, my name is Dawn. I am your instructor for this course. The first chapter in this course has to do with Introduction to Medical Assisting. A pretty simple chapter, but I'm just going to go over some highlighted areas that you'll want to read through in your textbook or focus on when you're going through your Smart Book learning assignments. You guys can read the learning outcomes. But the first section that we come to is the responsibilities of a medical assistant. Medical assistants are trained professionals that provide care to patients in what we call ambulatory care settings, where a patient can walk into the facility and then walk out of the same day. That could be your primary care physician's office, a specialty office, or an urgent care setting. Those are just some examples. The medical assistant assists other licensed healthcare professionals in providing care to the patients. These licensed healthcare professionals include a physician, a physician's assistant, or even a nurse practitioner. One term that you're going to hear quite a bit throughout your career as a medical assistant, medical administrative assistant, biller, coder, whatever it is that you want to pursue, is the term patient navigator. A patient navigator is basically exactly what it states. It is an individual in the healthcare profession that helps patients to navigate through the complex healthcare system. So if you have a patient who enters into the emergency room due to a fracture, that individual will get that fracture stabilized, and whether it's through a splint or through a temporary cast, and then sent home. And in the discharge instructions, it's going to tell the patient to follow up with either their primary care physician or an orthopedic surgeon, an orthopedic specialist. And so it's the patient navigator's responsibility to make sure that that patient understands what their next step is in the process of the healthcare system. And then it could be that patient needs to go to the orthopedic surgeon, and then they need surgery. So then from there, they go to the hospital or a surgical center to receive surgery. Well, then what's their next step after that? That's what that patient navigator is. So make sure you know the function and the definition of the patient navigator. The next section we come to is medical assisting organizations. There are many medical assisting organizations that students can either just look up the information about these organizations, or they can even become members of the organizations. In addition, these organizations can offer different certifications that you can receive either on the medical assistant clinical side or the medical assistant administrative side. So let's talk about the first one. The first one is the American Association of Medical Assistants. This is a great organization that only focuses on medical assistants. There's several other organizations that focus on healthcare in general or allied health in general, but the American Association of Medical Assistants, otherwise known as the AAMA, only focuses on medical assisting. So I put the website on the PowerPoint for you guys, so if you wanted to navigate to that link and take a look at some of the information on the American Association of Medical Assistants, that would be great. You're definitely going to want to look to find out what certification they have to offer, what CEUs that you need to take in order to renew that certification, how much it costs, how many years you have to pass in order to renew. You'll probably see that on a future test. The other one is American Medical Technologists. This one here has several different certifications for medical assistants, whether it's the clinical side or the administrative side. So definitely take a look at that. Again, you're going to want to look at the AMT as far as what certifications they have to offer, how many CEUs you need to renew, how much it costs, and how often you would need to renew that. If you click on this link, that'll take you to their website, so that way you can research more information on American Medical Technologists. There's several others here that are on this slide right here. National Health Career Association, otherwise known as the NHA. This is another reputable organization where you can see it offers the Certified Clinical Medical Assistant or the Certified Medical Administrative Assistant. There again, here's the website, so that way you guys can navigate to that and look for more information. But there are others that offer different certifications for medical assistants, whether it's going to be in the clinical side or the administrative side, again, or both. All right, so now we go to medical assistant credentials. You'll often hear the word certification and registration. So different organizations have a certified medical assistant, whereas other organizations have a registered medical assistant. As far as the difference between the two, there really isn't any difference between the two as far as your hiring organizations. Just as long as you have the certification, that's really what the organizations are looking for. So let's go through some of these. Medical assistant credentials, we've got the AAMA credential. I told you about, taking a look at what credential the AAMA offers, how many years you have to renew, and then how many CEUs that you have to renew. You can see the AAMA, the CMA, Certified Medical Assistant, is renewed every 5 years, and you must have 60 CEUs required for that recertification. Next one is the AMT credentials. So through the American Medical Technologists, they offer the Registered Medical Assistant, otherwise known as the RMA. That one there, you recertify every 3 years, and then you have to have 30 CEUs required for recertification. Again, you can look up all that information on their websites to get further information. So then the next section that we're going to talk about are training programs. So at Muskegon Community College, our training program is the Medical Assistant Certificate Program or the Medical Administrative Certificate Program, in addition to the associate degrees. The training programs, obviously, with different academic settings, might have different set of curriculum. However, they need to measure the same information. So we have to talk about administrative skills and clinical skills. In the administrative portion, and of course the clinical portion, we're going to talk about insurance and reimbursement cycles. We're going to talk about claim forms and how we actually submit the claim forms and to the insurance companies to get payment on those. Healthcare rules and regulations, such as the healthcare, excuse me, sorry, such as HIPAA, related to confidentiality and privacy. Practice management. Practice management is probably a newer concept within the past 10 years, which is fantastic for electronic health record systems. Going further into that, so the U.S. Department of Education recognizes 2 accreditation bodies. The Commission on Accreditation of Allied Health Education Programs, otherwise known as CAHAP, they work directly with the Medical Assisting Education Review Board. So Muskegon Community College's Medical Assistant Program is accredited through the Commission on Accreditation of Allied Health Education Programs under the recommendation of the Medical Assisting Educational Review Board. Accreditation for a program is extremely, I say honorable and prestigious. It is showing that the program is following all the rules and regulations that are set forth by the accrediting board. We're teaching the students the curriculum that's required of every medical assistant across the nation. The other accrediting board is the Accrediting Bureau of Health Education Schools, otherwise known as ABHES. There are other organizations, or I should say academic institutions, that have accreditation through ABHES, which is required. All right. So then we have the work experience or the practicum. In any accredited school, students that are that are graduating from the actual medical assistant program must participate in a practicum where they must complete 160 hours out in the real world. If you are in just the medical administrative assistant program or the degrees, it is not required that you actually participate in a practicum. It is only for the medical assistant program. Each accrediting board determines the amount of time that a student must spend in the practicum, but under the KHEP accreditation, it's required that students perform 160 hours. Professional development. Medical assistants are professionals. They have to have the expert training in order to perform their job in the field. So therefore, it's important that you maintain that professionalism by participating in professional development in your field. In healthcare, everything changes, so you want to make sure that you're up to date on the best practices in the field. Another way to do this is volunteer programs, volunteering at your local health department, the local food banks. Those are great ways to get some professional development underneath your belt. It's important because, again, you guys are multi-skilled healthcare professionals. It's cost effective. There's a high demand for medical assistants. Professional development expands your career opportunities. So there's multiple ways and reasons for the professional development. Networking. I can't express how much networking is critical to your success. Knowing someone in the field and getting to know them and sharing what your experience is and what your training is, that will help you further your career down the road. In addition, networking, you can find multiple opportunities for workshops or for conferences to attend to continue on with your professionalism growth. Scope of practice and standard of care. So in your book, it's going to talk about scope of practice versus standard of care. It's really important that you understand the difference between scope of practice and standard of care. So let's read this. Standard of care is a legal term that refers to the care that would ordinarily be provided by an average, prudent healthcare provider in a given situation. Pretty simple. But the scope of practice is a set of procedures that can be performed and the actions taken under the terms of their professional license or training. Again, medical assistants cannot perform any skills that they have not received the proper training for. And one of the skills that we use as an example in the state of Michigan is starting an IV. In the state of Michigan, it is highly frowned upon that medical assistants actually start an IV. Therefore, we don't teach students in the medical assistant program to start an IV. They won't use it. They won't need to do it because your providers, your physician, your nurse practitioners have all come together and said, we really want nurses to be able to start IVs. They have that higher level of assessment skills in order to start and maintain an IV. So therefore, medical assistants are not taught that in their academic setting. In other states, though, it's actually where medical assistants are actually starting IVs because in their state, they want the medical assistants to know that skill and they want the medical assistants to be able to actually perform that IV. Again, it goes state to state. So here's some examples of standard of care versus scope of practice, and you can kind of see the difference between the two. So standard of care, greeting a patient upon arrival, providing information about a location of a testing center, or washing hands prior to entering a room. Any prudent healthcare professional is going to do those things regardless of their qualifications, regardless of their academics, regardless of their training. Scope of practice, though, if you can look and see, it says safely administering a medication, assisting with in-office procedures, or assisting in prescription refills. an actual medical assistant is trained to do those things. And so that is within their scope of practice to perform, whereas any other healthcare professional may not be trained in these specific tasks, such as like a physical therapist or physical therapy assistant. They're typically not trained in safely administering medications, so that's not underneath their scope of practice. So make sure you know the difference between scope of practice and standard of care. You will see that in a test or an upcoming assignment. So pretty much that's it for the first chapter. It's, like I said, it was a pretty simple one. If you have any questions, please feel free to reach out to me.